Hello dear people, here we are again in our video series about the Buteyko method, and today we want to talk about hypertension or high blood pressure and its relation to the Buteyko method. So we both had many students with hypertension or high blood pressure. Can you please tell us a little bit what people can expect when they do the Buteyko method in relation to this condition?
Yeah, people experience quite quick reduction in their symptoms, and symptoms of course can be different, can be headaches, migraines, like people may have poor mood, like emotions are not well when they have high blood pressure. And usually people try to control it with medication, but there are also those people who are looking kind of for more natural solutions. And we also maybe believe that kind of because of disease, some other symptoms develop, so we can maybe in addition poor sleep, low energy levels, unable to exercise. So many things can happen together when people have this condition. And what we do for this method in general, we slow down our automatic or unconscious breathing pattern. This is the purpose of Buteyko breathing technique or breathing retraining in general, because people also can apply Frolov device, some other DIY device, other similar techniques. So the idea is to slow down our breathing the way we breathe day and night. And that allows us to address hypertension successfully and even reduce medication if people take any. So therefore people, when we start doing these exercises, they quite quickly, depends on the person, may take 3-5 days, maybe more days, depending on how we take medication. We would notice that at the beginning there is a tricky effect which Buteyko discovered many decades ago, and he described it in medical literature as well, meaning that people may experience a slight increase in their blood pressure. Even though we have more energy, we sleep better, we notice already positive effects, but if we do the measurement, the number of blood pressure, it's going to be higher for some maybe 3, 5, 7 days, which is a temporary effect, because later it decreases and gets even below the norm if we continue the same dose of medication if we take it. If we don't continue, some people have like little mild hypertension, maybe like 150, 160, only not too high, and then we would be getting the results closer and closer to the medical norm. That would take usually some weeks, maybe up to 1-2 months of time before we are able to completely normalize the blood pressure and do it the natural way, meaning that we don't require medication anymore. And if we try to do medication, that it's another problem, danger here is that of course the blood pressure can become too low, because this medication is reducing blood pressure. So if we get normal breathing pattern, we achieve like up to 40 seconds high numbers for the body oxygen test. Then the blood pressure becomes, again, within the medical ranges, normal ranges, and medication is not required. It's a very good achievement because it allows to also to avoid complications, because more severe forms of heart disease possible, people may require more medication, even sometimes heart attacks, other abnormalities can take place. And therefore these techniques allows students, if they practice, and for practice we would generally require 60-90 minutes of breathing exercises per day, slowing down, like meditation type, easy, relaxing your mind, relaxing your muscles, and relaxing your breath. All these activities allow us to make small changes during a session, and then we're going to last for some hours. Later people do another session. So if we continue to move in this direction, later we involve, at the beginning we have little physical exercise, let's say 1 hour of walking throughout the day, later a little bit more, people start to enjoy physical exercise. Later we are able to maintain very good health, normal blood pressure without medication, and even without breathing exercises, without doing formal sessions. Probably, I would say for most students, physical exercise in the long term becomes a factor which allows them to keep the same blood pressure, to keep the same health state, level of breathing, having the same easy, normal breathing pattern. And that's a natural solution to hypertension rather than using medication.
And one addition I want to make here is that hypertension belongs to the conditions which are comparably easy to solve. So we would have for example, there are some conditions which need a little bit more efforts to overcome, and hypertension normally, at least for my students, is not so much of a problem if they follow the suggestions we give to them among them to do breathing exercises every day, and of course lots of lifestyle changes and things like this. Yeah.